I should tell you something about Dr. Moss that's not in the video, which is that you are a pediatric surgeon, not just a health executive, but a practitioner with many years of experience. So I think gives you kind of a unique insight in leading children's health. So I just wanted to start out with that. And then to talk too about the fact that you're caring for pediatric patients across some of the wealthiest communities in the country and the poorest, deep red and very blue places, rural and urban centers. So I think you've got a good perspective on a cross-section of patients, our youngest patients, our youngest Americans in your care. So with that, maybe you could just open up for us, Dr. Moss, a little bit before we get into the thick of things on some of the common threads from such a diverse cross-section of patients that you're seeing sort of in terms of health, health care, and equity when it comes to our youngest folks.
Yeah, thank you, Dafna. Since you brought up my background as a surgeon, let me explain that through the lens of my personal perspective of taking care of patients for a lot of years and what led me on this journey. I'll start out by framing my comments to say that the theme of this conference is equity, and we're talking about health equity here. Most of my comments are going to be framed around health and health of our children and health of our society. And the reason for that is the two are inextricable. I saw some data recently published in the American Journal of Public Health that took a 7-year period of history about a decade ago and did the math. And if we had all the medical advances we had 15 years later back then, about 37,000 more Americans would be alive. So that's an impressive number. During that same time period, if we made no medical advances and eliminated health inequity between black and white people in this country, 1.4 million black people would be alive that are not today. So there is no such thing as health in America without health equity. So through that lens, my experience as a surgeon, I had the privilege of taking care of really, really sick newborns. So babies with the most complicated congenital problems, congenital anomalies, really complicated problems of prematurity, advanced cancer, things like that. And through my career, it struck me that in this country, that's what we do really, really well. And if you're unfortunate to have a baby with that kind of problem, you want to be here more than any other place on the planet. But if you're the 99.9% of kids without those problems, this is arguably the worst country to be in the developed world. And our health indices are not just poor, they are at the bottom of the OECD. And that's what drove me out of the operating room to a role like this to have an influence there. Yeah, those numbers are stark and important and really should kind of guide us just generally in our conversations about health equity. For those who were here earlier, I spoke with the FCC chair, and there was kind of a lot to get to in that fireside chat, and I think this is a conversation that we just need to let breathe a little bit, because sometimes they're weighty issues and important in completely different ways. So I hope you'll kind of indulge us in that. And when you talk about some of those numbers and if we knew then what we know now, and knowing now, how do we fix this? I mean, as you said, it's not a secret what's gone wrong, and how many people are suffering as a result. I'm not saying can you just tell us what the solution is to all our problems, but just from your perspective and being able to kind of see sort of on the ground day to day, where do we need to go here for children's health? So one thing that really drives me crazy, that is our parlance all the time, is, well, healthcare is just so complicated. It's such a morass, we'll never figure it out. And my view is it's not complicated at all. It's simple. And from my point of view, we need to do 3 things. Understand what health is, pay for health, and start with children. So let me go just a little bit deeper on those. With respect to understanding what health is, mountains of evidence will tell us that about 20% of health is due to medical care and good medical care, best medical care in the world. 80% is due to other factors: education, safe housing, freedom from violence, avoidance of adverse childhood experiences are way more prominent factors that determine the health of our kids and ultimately the health of all of us than medical care. We don't get that in this country. We spend $4.1 trillion a year on medical care, and we throw medical care at health when that's not really the answer. We will spend $1 million to put your child with asthma in the ICU 3 times a year. We won't spend $50 to get the mold out of your house. That's health in America.
Right?
So second point, pay for health. Of that $4.1 trillion in this country, almost every penny of it goes to pay for the opposite of health. Our system is based on volume of procedures and complexity of procedures. That's where the money is. It shouldn't be surprising to us that the behavior follows the financial incentives. So we do triple the number of MRI scans as any other country in the OECD. We do double the number of CT scans. We do triple the number of coronary bypass operations, quadruple the number of hip replacements. That's what we pay for, and we're getting exactly what we pay for. But with respect to health indices, we're doing terribly because we're not incentivizing that. And then finally, the point I think that's most important to me is start with children. You know, we think of the killers in our society, cancer, diabetes, heart disease, as adult diseases, and in one way they are. But if we want to prevent those diseases, or if we want to influence the incidence of those diseases, it's all about childhood. By the time you're an adult with those problems, we can throw that $4.1 trillion at you and maybe help you a little bit and buy you a few extra months, but we're not fundamentally changing society. I like to think about the impact of kids as a lever. That's a great analogy, because a lever is a little bit of movement at this end of the lever causes a massive amount of movement at the other end of the lever. We can influence health in our society in a tremendous way with just tiny investments in kids.
Yeah, I really appreciate that. I think a big part of what we do at US News is thinking about sort of solutions-based journalism, reporting, perspectives that we can get at, especially in health and education, politics and policy as well, but especially in children's health. I love how you talk about sort of the healthiest generations. Like, how does everyone in this room like raise the healthiest next generations? What can we do to kind of get to that place where we're saving our kids from having that kind of disease statistics or possibilities that we grapple with ourselves? How do we sort of set the stage for those who are kind of to come after us?
Yeah, so I'm hearing in your question, Dafna, are there things,
you're a parent of 4
kids. Are there
kids.
interventions that we can do that are actually going to make a difference? And I'm going to tell you, ironclad, peer-reviewed, evidence-based research says absolutely yes. Let's take a couple of anecdotes, a couple interesting studies. There's a study called the Abecedarian Preschool Project, decades ago, randomized study that took 2 groups of kids. One group of kids went to preschool that included some basic nutrition education. Remember, these are kids under 5, so this was not PhD level stuff. A healthy snack every day, and access to primary care. Control group, only difference, this is a perfectly good preschool, met all the other criteria, just didn't have these 3 things. And those 2 groups of kids were actually followed for coming up on 40 years now, prospectively for 40 years. And down the road, those kids had a 40% lower incidence of high blood pressure, metabolic syndrome, that killer combination of glucose intolerance that leads to heart disease and cancer. In the US, it's 25% incidence. Metabolic syndrome was 0% incidence in that study group. These kids had a higher high school graduation rate. They had higher median incomes.
Amazing.
Massive change in their life trajectory. The cost of that program, $700 a kid. That's work that won the Nobel Prize decades ago. So it isn't about figuring out what to do, it's about having the will to actually do it.
Yeah, those are stark. Tell us a little bit about sort of healthcare providers and what role can they play in equity here, in health equity, especially for our youngest patients, but throughout there.
So what I like to think and communicate to the doctors and nurses and other providers that work at Nemours is get out of bed every day thinking my job is to create health, not just treat disease. Doesn't obviate treating disease. That's a really important part of what we do. But if that's all we do, we're right back in the situation that we've been discussing here today. So I like us to have the perspective of, yeah, I want to take care of the patients who come to my clinic, but what's my obligation to the kids in my neighborhood, my community, whatever I consider my service area? What do I do to make them as healthy as possible? So I can give you a couple anecdotes about things we're doing as a system. We've invested heavily in a program called Reading Bright Start, which is an evidence-based early intervention for reading between ages 3 and 5. Touches about 200,000 kids a year now in 38 states. It should touch millions, but we're working on it. In this program, we focus on kids who are in the, quote, struggling category. So they're more than a grade and a half or two behind age-appropriate reading level. And they go through this relatively short program. Over 2/3 are at or above age-appropriate reading level just by the program alone. And it markedly changes their trajectory. I don't have to tell the audience that the single best predictor of whether you're going to graduate from high school is 3rd grade reading proficiency. So set that early, leads to graduation from high school.
Number increased because of COVID? More kids who needed that because of COVID?
You know, there's kind of mixed opinions on that data. I guess my take on it, it was so bad in the first place that it almost doesn't even matter what COVID did to it because we still got to address it at that level, but fair question.
Good point. Sorry, I interrupted you. You had another good anecdote coming.
I guess another one I'll tell you about is we've been pushing hard on social determinant of health screeners, so screening for things like food insecurity, housing issues, education issues, problems at school. We're now doing 180,000 of these a year, and in about 12 to 15% of them, we're finding direct identifiable needs and are looking at closed loop solutions to address those needs. Those kind of things, you do those kind of things, and you take that classroom of 20 kids, and 5 of them don't have diabetes when they're adults. 10 of them never go in the ICU when they otherwise would, and their healthcare costs are a fraction of what they would have been if we just let society play out.
Yeah. Lots of policymakers in the room. What should they know about the data, and what should they be coming away with from that? How can they use that to sort of help create better policy?
So there are some policies focusing on the broader view of health that are percolating around Congress. Not much is moving because of the gridlock that we're experiencing, but the Safer Kids Act, the Caring About Social Determinants Act. So I don't want to say that there's nothing out there. I think the core issue comes down to financial incentives. We need to have the will to change the incentives of this $4 trillion system to pay for health. I like to call it a pay for health system as opposed to pay for volume and complexity system. We think it's so complicated to transform behaviors of the health system. It's actually pretty simple. Just people do what they're incentivized to do. And if we're going to incentivize you to do the opposite of health, we're going to keep getting what we're getting today.
Yeah. How does technology play into this, sort of into understanding the data, but also access and information, so people kind of have a little bit more of a sense of empowerment, which I think when it comes to health, people don't feel that empowered, and especially in pediatric care where it's kind of urgent and frightening. How do you give people that sense of empowerment?
Well, I mean, there's a lot of technologically based tools that we found to be really effective. We've got a group in our care management section of what we do, which is a big part of what we do, who are using geospatial coding to do some really interesting things, to actually have objective data on, if we're going to put a clinic in the underserved area, what's the sweet spot, exactly where to put it, where the most people are going to be able to come? Or hey, we've seen a uptick in ED visits from a defined zip code or neighborhood that we would have never been able to put together without the geospatial coding underlying everything we do. So, you know, there's examples like that, but in my opinion, technology is the enabler of the intention, and we don't have the intention right. And plenty of technology out there, a lot of cool stuff we can do with AI and all of the associated tools there. But until we understand what health is, start paying for health, and start with children, it's not going to matter so much.
It's interesting. I'd asked the FCC chairwoman about AI and sort of the exciting part and the scary part. But for in the medical frontier, there does seem to be some really exciting things happening. And how is it impacting pediatric care now, and how are you using it?
So an example that I like the best is one of the things that has most destroyed the doctor-patient relationship during the time of my career is the electronic medical record. And I have a picture.
Everyone agrees.
I have a really good picture that was drawn by a 6-year-old who was one of my patients of my day at the surgeon's office, and it shows the patient sitting on the exam table, and the mom right there, and the nurse looking at the patient, and the doctor with his back to the frame looking at a computer screen typing on the computer. So one of the things really interesting that AI has done is we're using it for clinical documentation. So through natural language processing, doctor goes in, nurse goes in, they actually talk to the patient and family just like they were paying attention. And the AI system captures all that dialogue and turns it into a medically appropriate documentation note. So I thought that's an interesting angle where we're using the highest technology available to actually go back to the roots of the human-to-human interaction that's so important.
That's a good one. I'll have to tell her that one. Really liked it. I wanted to ask you, just generally, kind of in your experience, both, again, sort of having a good cross-section, and I really think Nemours just sort of is well placed across the country in 7 different states to just be able to really kind of have an eye view the way others cannot at the moment. Just a little bit what you think, again, just what it means to you to go that extra mile of that sort of like well beyond medicine, like what it's going to take for all of us. I think we were both pretty moved when we heard in the last panel from Dartmouth that the Dartmouth president talks about how your healthcare is actually part of your educational experience, and you're going to succeed if you're succeeding kind of on all fronts. And so talk a little bit about that for again, for sort of our youngest patients.
Yeah, so Nemours does have the unique privilege. We're the country's only multiple hospital, multiple state system of pediatric care with that dispersion. So as you said at the beginning, Daphne, we really are in the richest counties in the country, the poorest counties. We're in the reddest states to the bluest states. And it makes us better because it gives us a broader perspective on what health really means through a lot of different lenses. I think it comes back to what I was referring to before, which is seeing our role in society as being the stewards of child health, not just the place you go when your kid has a rare disease and you need help. It's an and, not a but. We'll always do heart transplants and CAR T therapy and be there for the sickest kids in the country. That's part of what we do. But that's not enough. We need to be there for every kid in the country, and we need to whatever extent we can, prevent those bad problems from happening in the first place and create a different trajectory. You know, I've spent my whole career advocating for, my whole professional life advocating for children's causes. And if I say you should care about children, children are the future, you know, that resonates with about 20% of the population. And I'm sorry it never gets better than that, and I wish it got better than that, but you're kind of preaching to the choir. What people need to understand is that if you care about the health of our society, our adult population, if you care about workforce productivity, if you care about national defense, if you care about the state of our economy, then you should care about child health, because that's how you get there.
Yeah, I love that. I like the idea of healthcare that's for the health, that's for everyone who's healthy and not just there for the emergency moments. Please help me thank Dr. Moss. It's really very informative. Thanks. I appreciate the passion.
Thank you.